Hello, Danny Blythe here, looking at sleep in traditional Chinese medicine. We'll get an overview of sleep, we'll look at yin and yang and simple sleep hygiene, we'll look at circadian rhythms, we'll look at midday, midnight and the 24-hour body clock, and we'll look at sleep cycles and the 5Zhi. An overview of sleep. Good quality sleep, 10 to 15 minutes to get off, 7 to 9 hours of sleep with 85% of time spent in bed, waking no more than once for less than 20 minutes. If you're taking less than 15 minutes to get off, you're probably sleep deprived. We need more sleep if we're stressed, if we're studying, if we're training, or if we're ill. Aim for enough sleep across a week rather than over a night. In the UK, 77% of people are not reaching this, and reduced hours, under 6 hours sleep a night, can lead to increased risks of depression, increased appetite, obesity, reduced concentration, high blood pressure, and more risk of infection. What does sleep do? Restoration, growth, repair, wound healing, processes experiences into memories and removes emotion from traumatic experiences. We spend a third of our life doing it. All creatures sleep, even in hibernation. It's not just about rest. Even bacteria have active and passive cycles, and mammals and birds have REM sleep. Hunter-gatherers often sleep in biphasic patterns, so 7 hours per night, which is usually 2 hours after sunset until dawn, and then 30 to 60 minutes in the day, especially so in hotter climates. Humans have less sleep, but double the REM compared to other tree-dwelling apes, which are obviously a lot safer. People sleep less and later in the few days before the full moon. Too little sleep leads to reduced immunity, 70% reduction in natural killer cells, reduced stem cell production after one sleepless night, and increased allergies and autoimmune disease with symptoms with poor sleep. Acute illness, cytokines, increase rest and sleep, fevers spike at night if sleep is good. 6 hours or less sleep, you're 4 times more likely to catch a cold after exposure, and vaccines are less effective. And insomnia is a predictor for heart disease, for diabetes likelihood. Short sleep, 28% increase, difficulty getting off, 57% increase, difficulty staying asleep, 84% increase. 3 bad nights, blood sugar increases. Obesity in kids, risk is increased 45% with insomnia. And perception of pain increases, so things like IBS, headache, osteoarthritis will get worse with worse sleep. Reduced sleep leads to reduced sperm count and testosterone, obviously affecting the Jing. Poor sleep associated with social withdrawal, loneliness, and less healthy food choices like junk food and alcohol as the reward pathways change. With bad sleep, not enough O2 and CO2 builds up. Carbonic acid forms, pH reduces, and the muscles in the lungs are stimulated to breathe faster and deeper, and can even stop, like sleep apnea. Peripheral circulation reduced, so blood pressure increases, the heart muscle increases, adrenaline increases, and that's why a lot of problems happen. In Chinese medicine, effects of too little sleep, first of all blood deficiency, and then kidney deficiency, and then Jing deficiency. So think about how eye patches come as you get less and less sleep.